Assalamu alaikum and good morning. This is the third of the series of lectures which is on scoliosis case finding. We'll be talking about the physical examination, which will consist of inspection, the forward bending test and the differential spinal function testing. Scoliosis, we have to determine the very first thing even before going to the x-rays or the Moiré, and which we are talking about. We have to go to the very first one is physical examination and the inspection. In the principle of physical examination, 80% of the examination should consist of inspection. This is the most important one and it is mostly overlooked by physicians. For the inspection for the purpose of finding and detecting scoliosis, it is mandatory that the child should be undressed to short underpants, boys in briefs and girls in panties, and they should be barefoot and all clothing should be removed above the waist, because we are looking at the body deformity, and unless and until we are able to see the body, we will not be able to judge this examination and we will not be able to make a judgment. Start from the top to the bottom. If you are able to see the ears, whether the ear lobes are level or not, note it down. It's not saying that if any of these things are there that the scoliosis is present. We'll have to combine and there would be a complex method to determine the risk for acquiring a scoliosis. Then you come to the shoulders, and it should be the trained eye. Maybe not everybody should be able to, or not a layman should be able to check and find out if the shoulders are drooping. But with a proper practice, even maybe the mother should be able to pinpoint whether the shoulders are level. On both sides from the neck, where the shoulders are forming, both sides are symmetric. The key is symmetry. The human body is symmetric about the sagittal plane, and any asymmetry about the sagittal plane is an indication. It is a warning sign. It is an early warning sign. It says that there is something wrong and needs to be further processed, needs to be further examined. At this time, we should not be making the judgment that the child has the scoliosis or does not have the scoliosis. This is not our purview. There would be a series of tests. But the first one is this inspection. If you don't have the inspection, go to the x-rays, which means you are exposing the child to ionizing radiation and damaging the body. It's unnecessary. So the inspection does not carry any risk. Just undress the child to underpants, and that's we should be prepared. Then the next thing is the scapulae. The bony landmarks which are coming out, I think, at the level of the shoulders, which you can see on both sides. We are looking at the back, where if these scapulae are at level, they are, the line joining the scapulae is parallel to the horizontal plane. I sometimes put a plastic ruler in order to find whether the scapulae are at level. Why I am using plastic ruler, not the steel one? Because the steel one would inflict cuts and abrasions on the child. Also, the plastic ruler is transparent and you could see even the position of the scapula on the back from the plastic. Then the other thing is the midline of the back. If you are doing a proper inspection, you can see whether the midline of the back is completely straight like an arrow, or it is curved, whether the curve is a C curve, or whether the curve is an S curve, which means there is a combination of two curves. And then you come to the body triangle. What is body triangle? When your hands are joined with the body, they are aligned with the body, then in the small of the back, there is a gap, and the gaps is on both sides. Whether this gap, which is we call as the body triangle, is making an equal angle. Sometimes this body triangle is not visible, but sometimes it is. And if it is showing a C or it is showing an S, even from the examination of the naked eye on the naked child, that should give you a clue that there is something wrong, and then you will have to proceed to the orthopedic surgeon for a further evaluation. Then there are spinal dimples at the level of the hips, slightly lower the underpants, so that you can see the level of the hips, and then there are spinal dimples, and you visualize if these spinal dimples are level or not. Again, if you can use a plastic ruler to find out if these spinal dimples are level. If they are not level, this could be an indication that the legs are not equal. There is a leg length inequality, and we'll be talking in the differential spinal function testing that could produce an artificial scoliosis. It's not a real scoliosis, but because of the leg length inequality, the body is imbalanced and the artificial scoliosis could be present. Then what you could see is that if you are seeing some of these deformities over here, you can ask the child to hold the hands above the head and join the palms as you are seeing over here and try to stretch the feet. If there is an asymmetry in the midline of the back like C and S curve, and you see that it is reduced or disappears, mostly the C curve would disappear, then this was because of the posture. You could do it from the front, then you can ask the child to turn around and you could try to look the same thing from the front. From the front, again look at the earlobes, look at the level of the shoulders, look at the level of the nipples, then again midline of the front, and the very important thing is your knee joints. When from the front, whether the knees are at level. If they are not, then that could also be an indication that there could be a spinal problem or there could be a trunk deformity. Then you should also try to look from the side. From the side, you can look and you can ask the child to pull the hands in the front and join together, and when the child is standing, then from the side you are looking at the spinal column. That's where you will be able to detect kyphosis or lordosis. Scoliosis, as we have talked, it's the lateral curvature of the spinal column in the frontal plane, but if there are some curvatures in the sagittal plane, that is called kyphosis. If this is in the thoracic region and there is a curve, there is an accentuated curve of the back, then that is called kyphosis. If the curve is reduced, then that's called flat back. If there is a curve in the lower portion in the lumbar region and the front, like on the belly, it is an accentuated curve over here, then that is called lordosis. And sometimes it could be kypholordosis. If there is an kyphosis present, it could produce a combination of lordosis. And if it's combination of kyphosis and lordosis, then that could be called kypholordosis. Well, if that is the thing, so mainly when you are inspecting in this standing position, then generally you will be getting the clue about the lateral curvatures. In order to visualize the lateral curvatures further and see whether the body is completely aligned, then you should be using the plumb line on the back and on the front. On the back, if the plumb line is going from the midline of the back, it should go through the hips and it should pass through the legs, in between the legs straight. And if it is completely straight, then you could see that the body is aligned. Otherwise, you will note that plumb line misalignment. Similarly, you do it from the front. Drop the plumb line from the nose and whether it is passing through the navel. If it is not, just like I think the reference which I will be giving in the figure 3 of the reference of the paper, you will see from the front, the plumb line is not passing through the navel. And then again, it's not passing through the navel and then it's not going through the middle of the feet. Then this is the plumb line misalignment. Then the next thing which you should be looking, and that should be giving you the indication of the rotation of the spine. Remember, scoliosis is a combination of lateral curvatures and rotations, or lateral curvatures or rotations, either of them. So, in order to clearly visualize the rotation, we perform the forward bending test. Without flexing the knees, with the feet heels together, the child is asked to bend forward and try to touch the toes. The hands should be, palms should be joined together, and they should be going through the middle of the feet, middle of the legs. If you can touch the feet or the floor over there, that's good. The flexibility is there, but sometimes if the child is not able to do that, then wherever it is, you should be noticing and measuring the distance from the floor till the child. So that is really giving you the flexibility of the spinal column. You will be performing this test in 3 positions. The first one is when the child is facing the examiner. You should be able to see clearly here that the knees are not flexed, right? Feet are straight. And the other thing which you should be noticing is that the toes are in the same line. If one of the toe is forward and the other one is backward, then the test is not correct. Make sure that toes are in the same line. And when the child is bending, then look at the bare back. And if one side is elevated than the other, then this test is positive. This is giving you the lumbar region asymmetry. Note down which side is positive, whether it is the left or the right. Then you can ask the child to stand up and have an about turn, perform an about turn so that the child's back is facing you. Then perform the same maneuver again, this time making sure that the heels are at the same line. Last time you saw the toes at the same line. Here, now you are looking whether the heels are aligned and they are at the level. And the child is bending. This time you are looking at the asymmetry of the both halves of the back. And then again, it is giving you the asymmetry in the thoracic region. Again, note down whether it is on the left side or the right side of the child, right? Now, if both of them, for example, are on the left side or on the right side, same side, then it may be an indication of C curve. But if in the front and back, they are on the opposite sides, that could be an indication of S curve. Remember, C curve may be basically, generally because of the postural problems. And when you can ask the child to stretch, just like I described before, and it could disappear. But S curve is generally pathological. It would not disappear from asking the child to stretch or hang freely from a bar. So, you have to have this one. So, these two you have done. The next thing is that you have to confirm. Whether you have seen it, let's perform another test when the child is facing you. When the child is on your side. Before that, you ask the child to turn 90 degrees so that the child's side is facing you. And which side is facing you is the opposite one on which you have got the asymmetry. If you want to see, for example, the right side symmetry either from the front or from the left, then you should have child's left side towards you and ask the child to bend again. Remember there you saw the asymmetry on the right side. So right side is away from you. So in the side bending you will see the right side would be elevated and you will be able to see this elevation clearly. So now you have seen this elevation and you have confirmed this test. It's not only the one test, now you are performing 2 tests. Similarly for the front, if you have got, from the back if you have got an asymmetry on the left side, then you should ask that the child should have his or her right side towards you and then perform the testing. Then the left side, concentrate on the left side which is away from you, and if there is an elevation or asymmetry, so it would be shown clearly. This we have done, but still we are not in a position to label the child having scoliosis. So in order to do that, we also perform another test which is called Moiré Fringe Topography. I'll describe you in detail, but here I'll be talking about little bit about differential spinal function testing, in which we are able to differentiate from the scoliosis-like conditions from the true scoliosis. The true scoliosis is the pathological curve which is not corrected from hanging, from stretching, from correcting the posture. It is there and should increase. That is the one which we need to follow up and treat if necessary. And then we'll be talking about the treatments and so on. But first let's see if it is really a curve or not. So for doing that, we use a combination of visual tests, standing and sitting, and forward bending, standing and sitting. A combination of visual sitting and forward bending sitting, if both of them are positive, then which means we are suspecting hip weakness. In order to confirm this hip weakness, we can ask the child to stand up and hold one foot with the hand, one foot in the air to a count of 3. Then if the child is standing on the weak hip, that would be elevated. And do this for the next foot, other foot, and then try to find out which foot is elevated. Which hip is elevated. If none of them is elevated, the Trendelenburg sign is absent and there is no hip weakness. The other one is the visual standing and forward bending standing. If both of these tests are positive, then leg length inequality is suspended. Leg length inequality is suspected. In order to confirm that, we look at the spinal dimples. If the spinal dimples are level, then there is no leg length inequality. But if one of the dimples is elevated, which means there is a leg length inequality, and that could produce a scoliosis. If there is a hip weakness, that could produce a scoliosis-like condition, or if it is prolonged and not treated, then it would produce a real scoliosis. Similarly, if there is a leg length inequality and if it is detected, then I think the child should be wearing shoes to correct this leg length inequality when the child is walking, so that a scoliosis is not produced. Then we'll see a visual sitting and visual standing. And if both of these tests are positive, which means there's a postural problem suspected. And in order to confirm whether there is a postural problem or not, then we ask the child to have a mild stretching exam, as I have described before. And if this curve is corrected, which means there is no postural problem there. Then the last test is forward bending sitting and forward bending standing. If both of them are positive, then a spinal rotation is suspected. And for that, we have to see the forward bending on the sides, whether this is on opposite sides or it's better to perform a Moiré Fringe topography, because the X-rays, the AP lateral X-ray which I described before, that highlights the lateral curvatures. But a Moiré Fringe topography, that gives you, that accentuates, that highlights the rotations. So these two techniques are giving you two different information. So they should be used in conjugation together. They should be used together so that we can interpret it properly. In the coming lecture, then we are going to describe a little bit more about the Moiré Fringe topography, its significance, and how we have utilized it in our laboratory to detect scoliosis. And then if the scoliosis is detected, then what are the intervention options, the treatment options? So this we'll be talking in the next video. Thank you again for bearing with me, and see you later. Bye-bye.